name is Jennifer Robinson, and we are going to do a presentation today on heart failure. Heart failure, I wanted to go ahead and point out a visual here of the heart, just to remind how the blood flow goes through the heart, where the right atrium is, where the right ventricle is, then it goes through the pulmonary artery, and then goes into the left atrium here and down to the left ventricle. Over here, I just wanted to point out the circulation through the heart. The superior vena cava goes to the right atrium, through the tricuspid valve to the right ventricle, through the pulmonary valve, and then to the pulmonary artery. From the pulmonary artery, we go into the lungs. From the lungs, you have to pick up oxygen and head to the left atrium. From the left atrium, you're going to go through the valve and then go to the left ventricle. The left ventricle is going to take you to the aorta. That takes you to the rest of the body to provide circulation throughout the body. We go back, all the way back to the superior and inferior vena cava from the body. So what is heart failure? Heart failure does not mean that your heart has stopped or is about to stop. Heart failure is a serious illness in which the heart doesn't pump blood through your body as well as it should. So again, what is heart failure? Heart failure is commonly known as congestive heart failure. Heart failure is a clinical syndrome that can result from any functional or structural cardiac disorder that impairs the ability of the heart to fill with or eject blood. Inadequate perfusion of tissues due to a decreased cardiac output, systolic failure, and or an increase in pulmonary capillary pressures due to increased diastolic filling pressure. So that would be diastolic pressure. The blood moves through the heart at a slower rate with heart failure. CHF occurs when impaired function renders the heart unable to maintain output sufficient for the metabolic requirements of the body, or can only do so at elevated filling pressures. CHF is also characterized by a diminished cardiac output, forward failure, accumulation of blood in the venous system, which would be backward failure, or both. The signs and symptoms of heart failure. At this point, we're not distinguishing between right or left heart failure. The signs and symptoms in general are shortness of breath, especially on exertion, orthopnea, paroxysmal nocturnal dyspnea, coughing, a dry cough, coughing up white frothy phlegm, pedal edema, decreased urine output, fatigue, weakness, weight gain from fluids, loss of appetite. The patient or the individual will get full very fast, maybe chest pains and palpitations. Pathophysiology for heart failure. CHF results from a complex interaction between factors that affect the contractility, afterload, preload, and lusotropic function of the heart and the subsequent neurohumoral and hemodynamic responses that seek to create circulatory compensation. Most frequently, heart failure occurs due to progressive deterioration of myocardial contractile function, a systolic dysfunction. Causes include ischemia, pressure or volume overload due to valvular disease, or primary myocardial failure. The inability of the heart chamber to relax. Relaxing in the heart chamber would be diastolic, so it would lead to diastolic dysfunction. Causes include hypertrophy, most commonly fibrosis, amyloid, deposition, or constrictive pericarditis. But heart failure, again, occurs when another problem makes the heart weak or stiff so it doesn't pump or fill normally. Coronary artery disease is a common cause of heart failure. Other causes include previous heart attack, high blood pressure, infection of the heart muscle, lung disease, and problems with the heart valves. So again, just shortness of breath, mainly how would the patient feel having heart failure? So shortness of breath, wheezing, coughing with activity, weakness or tiredness, problems with breathing lying down, swollen ankles, legs, belly, and or feet, increased heart rate. We pretty much went over all of the signs and symptoms. Taking care of yourself with heart disease. The patient will want to weigh themselves daily, take their medications exactly as directed, follow a low sodium diet, avoid alcohol, avoid drinking excess fluids, maintain a normal body weight, get regular exercise, know the warning signs of heart failure, stop smoking, and keep follow-up appointments and make this plan a permanent part of your life. Common medications to treat heart failure. Diuretics. Diuretics are going to keep fluid off of your body, also known as water pills. ACE inhibitors are going to reduce the workload and help reduce heart remodeling. The beta blockers are going to reduce the work on your heart. Aldosterone antagonist helps keep fluid and reduce heart remodeling. Digoxin is going to help strengthen your heart, and Vital is going to help your blood vessels relax. This makes it easier for your heart to pump when it's relaxed. So home teaching, health promotion for patients with heart disease. We need to encourage them to weigh themselves daily at the same time every day, preferably in the morning, without clothes or in light clothing, after you urinate, before you eat breakfast. And also record your weight. Record it for when you follow up with the doctor so they can see what your weight is doing. Bring the record when you visit. If you do have a weight gain or a loss of 2 to 3 pounds in 2 to 3 days, or 4 pounds in 7 days or less, you need to call your primary health provider. Medications. Do not take any pills for pain except Tylenol. Do not take more than a total of 4,000 milligrams daily. Avoid all other over-the-counter pills for pain, as they can cause fluid gain. Medications to avoid, the Advils, Motrins, Aleve, or Orudis, BC powders, the Excedrin. Let's see the other medications. We kind of went over the other medications, the diuretics, but we do also need to talk about the aldactone, spironolactone, potassium supplements, and heart strengtheners. We talked about the digoxin, blood vessel dilators with the ACE inhibitors. We also need to encourage patients to eat a low sodium diet, to also read labels to be sure that they follow a low sodium diet. It also helps to eat foods high in potassium. We need to provide written instructions for patients that have foods high in potassium, low in sodium. Just again, some things that we need to encourage and educate patients to do that have CHF. One of the biggest is stop smoking. Smoking can make heart failure worse. So if you do smoke, you should stop immediately. We can provide, as nurses, information and resources to help the patient stop smoking. Limit alcohol consumption. As a general rule, you should not drink alcohol at all if you have heart failure. It damages the heart cells and can further weaken the already weak muscles. Avoid drinking too much fluid. Most people with heart failure can drink normal amounts of fluid. Do not restrict your fluids unless specifically told to do so by your primary care physician or your cardiac specialist. Also, encourage patients to drink fluids throughout the day. Get regular exercise with heart disease. We can provide information for the patients to promote exercise, the types of exercise that they can do. Know the risk for diabetes. Just don't ignore certain symptoms, so know the risk of diabetes. And that's pretty much a quick overall lecture of heart failure. Do y'all have any questions or any comments about heart failure? All right. Well, that will finish our lecture on heart failure today. Thank you.